So thank you for the invitation. And it's really an honor, especially with this audience, to walk through some perspectives and some directions that we're heading. And feel free to sort of jump out if there's some questions while we proceed here. And I'll try to detect it by Zoom, but maybe Sangeeta or somebody could help me out. It's hard to see everybody, but as was mentioned, I started at Stanford in September after 30 years at the University of North Carolina at Chapel Hill and 25 of those at NC State. The last 6 of which at UNC, I was leading Carbon, our 3D printing company. And it's fun to get back, I got my life back again and traded places with Ellen Coleman, who was our chair of our board, and she was former CEO of DuPont, and she's now leading Carbon. So it's really great to be back in academia. And this is my group. It's a really terrific group that's getting underway here, and a good group of graduate students, some folks from MIT on the list here, and a lot of other great schools. But it's really nice to be putting together pieces from different disciplines and different perspectives as we go forward here, and a lot of different departments. Gloria is a graduate of MIT. She's in the material science department, and Alex is a former student with Bob, and helping him out here as he transitions in the direction of his career. I think the other thing to mention is some of the things I'll talk about, also the team at Carbon. And so I'll talk a little bit about some of the new work and some of the work that the team at Carbon has been leading, and a really good group of people, another talented group, a lot of different disciplines. And I think it's also clear that, here in 2021, especially, the importance of being really clear about one's values. This is a list of values that our group has thought long and hard about, what we want to talk about and what we want to list on our website. And part and parcel of this focus is being clear about one's values. You can become a destination for excellence wherever it is, and recognizing the importance of people feeling included in what we're doing. And it's a key part of our group, and feel free to look at our website and the things that we believe in. So, the opportunities in precision health are many, and it's, the team at MIT has been leading a lot of these ideas of bringing together different disciplines and convergent thinking. And, our focus, building upon that perspective of molecular science, engineering principles, breakthrough understandings of biology, and ultimately their clinical translation is of a lot of importance to us. And what I want to walk through with you is a perspective on the things that we started in the nanoscience world, some of the challenges we bumped into, some of our approaches around some of those challenges, and current directions. Taking a look back, we began with a perspective in the thinking about the nanomedicine world, but nanomedicine typically is a bottom-up approach, very often where molecules or assemblies of molecules are collected or synthesized from the bottom up. And we were interested in a top-down approach, taking some of the lithographic techniques out of the computer industry for making carriers. And what's interesting is that when you think about Moore's law over the last, 50 years, but more recently, the last 2 decades, as sizes of the features on a silicon wafer got smaller and smaller, and it went from tens of microns to single-digit microns to hundreds of nanometers and tens of nanometers, that the microelectronics industry length scale is starting to converge with the length scale in biology. When you start thinking about viruses and cellular constructs. And so it was really thought to be the time to take some of these top-down techniques and use the precision that they have and the breakthroughs in dimensionality to start thinking about biological applications. And so we developed a technique building off the beautiful work from George Whitesides and many other people in the imprint lithography world to develop a technology that allows us to mold particles. We called this particle replication in non-wetting templates. And it basically starts with the lithographic techniques in etching silicon. So we would take a silicon wafer, we would etch it with features that may be in the order of tens to hundreds of nanometers or even microns, if you like, etch that into a pattern in silicon, and then take that silicon wafer and make a mold of it using, in this case, a perfluoropolyether. We were interested in fluoroelastomers as opposed to silicones, because fluoroelastomers are not swollen by organics as much as silicones are. So we were interested in the non-swelling characteristics, because we're going to mold organic liquids, including low molar mass organic liquids. We didn't want it to swell the mold or infuse into the mold. And we also wanted to get the material out of the mold. And so a low surface energy was helpful. So we developed this technology, and we spun out a company called Liquidia that scaled up these molds. And these molds would come to us in thousands of linear feet. And because that's what you needed, to make lots of particles. And, this is a good example, I think, where the interplay between startups and academic labs play a really important role. A lot of universities, and, Stanford, I think, is one of those. It doesn't allow a close relationship between startups and your lab. UNC, we did it. I mean, we managed conflicts of interest beautifully, and we were able to have close relationships. And so by getting thousands of linear feet of these molds, we could ask questions that we couldn't ask without access to the technology from the company. So that's another topic we can come back and talk about later. But bottom line is, we could take these molds, we can bring them in contact with another film that we spread a liquid, and shown here in red, using a Meyer rod. And using web-based technologies and a nip and roll-to-roll, and we actually worked with a lot of ex-Polaroid folks developing this approach, that we were, in a roll-to-roll process, able to fill these cavities with the liquid, and that we could, shown in red, and that this liquid could then be cured and form a particle, and that the particles could then be removed from the mold by bringing it in contact with another film, shown here with a yellow adhesive, pull all the particles out of the mold, dissolve the adhesive, and then you have a colloidal dispersion of your particles, where you went from a two-dimensional array into a dispersion. And we were able to scale this up, and Liquidia is now publicly traded and does this even on a kilogram scale now. And this is a way to get really precise particles of controlled size and shape, and out of a wide range of chemistries. In fact, we got really good at doing this out of a range of chemistries, and even partially filling these molds out of different chemistries, so that one could have, in a controlled manner, different kinds of chemistries in different regions of the particles, including these trifunctional or trichemistries, triphasic types of particles. And so this is a really valuable tool to make particles, a library of particles, controlled size, chemistry, functionality, and allowed us to really have a digital tool, I think of it as, of a precise particle size and distribution. And we began looking at things like intracellular uptake. And what's cool about these kinds of particles is you can see them, because they're like not normal shapes. And so you can easily see these inside cells. But the company, Liquidia, began focusing heavily on dry powders because these shapes would not aggregate or agglomerate easily. And you can have a lot of free volume and lack of packing. And you can get a lot of aerosolization at low energy input. And so the whole focus has been in things like pulmonary hypertension and COPD and other indications for dry powders. Academically, we began looking at a range of fundamental particle characteristics. One of the things that we're interested in, and everyone here knows, that you typically don't put large particles by intravenous injection, because they would accumulate in the lungs and cause all sorts of other issues. But red blood cells are a really great mimic or example of something that circulates for a long time. And part of the reason is the mechanobiology. And these particles, the red blood cells are very deformable when they're young. They get stiff when they get older, like many of us, and they can get removed in the spleen because they can't get through the fenestrations when they're stiff. Well, what we did is we designed mimics of red blood cells. And when we could match the mechanics of red blood cells, we found that you could put these 6 or 8 micron sized particles in an IV and have a very long circulation time. And so we began looking at the role of deformation for enhancing circulation times. On the nano side, we began looking at these, a range of particles, again, of precision particles of a wide range of shapes. And the whole idea here was, if you have an IV of a small molecule drug, the drug would dissipate very quickly from the plasma, from circulation. But if you could put that small molecule drug as a cargo in this polymer and be given its release profile from the particle, one could extend the plasma concentration of these drugs as a function of time relative to just a small drug. And that was just the ticket to enhance, for certain types of tumor types, we had enhanced survivability by basically extending the plasma profile from these kinds of injections. And so that was the name of the game for extending the drug concentration in solution. And that's what all of us in the nano world have been doing. You can then look very carefully with these precision particles, and you can look at the role of pegylation, which again is pretty standard. But when you make particles this way, we could very systematically change the concentration of PEG on the surface and keep the particle size constant, which is kind of hard to do. But this was a post reaction. And so we could go from a PEG brush to a PEG mushroom on the surface. And we could look at the role that has on circulation profiles. And then we could also look at fundamentals of sizes from 55 nanometers up through this systematic series of particles, and look at how particle size became a key parameter in biodistribution profiles. And because of the nature of the particles being so precise, we began thinking of them as calibration standards, and that we could in fact characterize the biology, the tumor vascularity even, by using different particles and characterize from a Rakesh Jain-like approach, looking at the clearance profile as a function of particle size in different tumor types, from lung cancer, ovarian cancer, epidermal type cancers, and other lung cancers. And so this was sort of, this is a walk back in history. But one of the things that became quite clear is that there was a number of tumors that even these very small nanoparticles that we were making were not able to effectively accumulate in. And in particular, pancreatic cancer was one of those tumor types. And it's well known that pancreatic cancers have a thick stroma associated with the cancer cells that prevent drug penetration. It's an important barrier to treatment, but it was also shown that the cancer cells are susceptible to chemotherapeutics, but it's a drug delivery problem. In addition, that these tumors have a blocked lymphatic aspect, and therefore there actually has a high hydrostatic pressure to these tumors. And you have this fortress-like wrapping with the stroma, and it becomes very difficult to get drugs into these tumors. And so given that challenge, we began looking at this more carefully and realized that, as you know, surgery is an important method for treating cancer. But in pancreatic cancer, because of the nature of the pancreas and where it's at with these major blood vessels, surgical treatments are really limited. And so a very small fraction of those that have locally advanced non-metastatic pancreatic cancer are not eligible for surgery because of the wrapping of the tumor around these major blood vessels. And so we began looking at ways of using an iontophoretic approach for small molecule delivery, where we would, this is a cross-sectional view, where we could have an electrode with a semi-permeable membrane and in fluidic contact with our chemotherapeutic in solution, and then we could apply an electric field and drive the drug into these poorly vascularized tumors. And so James Byrne, who's been with Bob in the past, developed this technology in my lab, and this is a more recent version of what these devices look like. And what we found with a PDX model, so these are human tissue extracted models for pancreatic cancer. So it really recapitulates the stroma challenges with drug delivery. In our hands and with our collaborator, Jen Ye, who's actually a surgeon, and her teams are pretty amazing. These PDX models are very good at recapitulating the prognosis and treatment associated with pancreatic cancer in humans, in that almost nothing works. And when you have these PDX models and you don't do any treatment, the tumors grow very quickly and the mice die. When you do a systemic IV treatment, you can slow the growth of these tumors, but they still grow. And what we found, for the very first time ever in this mouse model, is when you deliver gemcitabine locally, that we actually had a debulking of the tumor, that the mass of the tumor would decrease. And this was the first time we've ever seen that in this PDX model. And why is that? Well, this is now looking in a canine model with the details as we're getting ready to move this into the clinic. And you look at the plasma concentration of drug. When you do an IV, you have a lot of drug in circulation, as you'd expect. But when you deliver drug locally using this device, we find very little of the drug in the plasma. So we're delivering the same amount of drug to the animal model, but in plasma, there's very little found in circulation relative to an IV. And when you look in the pancreas directly, we see large amounts of this drug in the tissue of interest when we deliver the drug locally. And when you look at the amount of drug in the tissue of interest when you deliver the drug systemically, you have very little. And so this really reinforces the opportunity for mitigating the side effects and really amping up the dose that one can give, because you have a lot of dose limiting effects with these kinds of treatments because of systemic exposure. And the opportunities for local drug delivery and precision delivery really opens that up. And so not only gemcitabine, but also these very complicated, very challenging cocktails, FOLFIRINOX. A lot of people respond well to this, but you have to be very healthy to get this cocktail because it really knocks your socks off. It's a pretty potent cocktail, but we found that we could deliver this cocktail as well, and other types of drugs, including even some transfection agents. So we're off to the races on this. Vinod Kosa just funded this company in Research Triangle Park, and we think the pancreatic cancer is just a beachhead for local delivery, and there's lots of opportunities beyond that that are challenging places to treat. So as we think about the advantage of precision delivery, that was a pretty good example where iontophoresis allowed us to get drugs into places that's hard to do. And as we start thinking about vaccines, delivery is also an important thing to consider. And when you look into I got the Pfizer vaccine, which I'm very happy about, and didn't get the Moderna vaccine, but nonetheless, those needles went right through into the muscle, and it passed a whole bunch of cells that are in the dermis. It's actually a lot of the cells of interest, and it's a much more rich concentration of these cells in the dermis than you do in the muscle, and this is of interest for a lot of people doing the microneedle work. And Mark Prausnitz and others have been promulgating this vision, beautiful idea about using microneedles for drug delivery. And when I look at this field, it's so exciting. But one of the challenges is how these microneedles are fabricated. And again, here's another example of using the microfabrication technologies from the computer industry for etching silicon and metal electroplating and polishing, where people would make microneedles from these techniques. And you'd be limited in kinds of chemistries you could access here. But even if you were just using these as master templates and making a mold, there's a lot of geometries you like to mold that are hard to fabricate from these structures. And when you do molding, you have to think about your cargo and the mechanical properties at the same time, and it becomes quite challenging. And when you look at the range of microneedles, microneedles come in a lot of different flavors. They include solid microneedles, where you'd have a microneedle You could dip it into a solution, a free meniscus coating, for example, coat the cargo of interest and then insert those needles into the skin, and you have a dissolution profile based on the solubility characteristics and the geometry over a period of time. You'd also like to access hollow microneedles for liquid delivery, and then soluble microneedles for these kinds of maybe different types of drug release profiles. So, we developed a 3D printing approach that we thought could be a really new way to generate microneedles of unique geometries. And the 3D printing technology was a departure from how one practices 3D printing in the past, in that we're not only going to use light to initiate the polymerization and solidification of a resin, but we're also going to use oxygen through a semi-permeable membrane to prevent the object we're printing from bonding to this window. And this is an example, and maybe one of the movies Bob was referring to in the 3D printing, but you basically can have a platform lower into a liquid reservoir and then begin playing a movie in the ultraviolet. And you can pull these objects up, and the part will bond to this the platform, and then liquid will be pulled in underneath through a dead zone that's created by the oxygen. And this allows you to print continuously, and instead of a layer by layer approach. And when you do this, you can go way faster. And we're going 25 to 100 to even 1,000 times faster, depending on the chemistries and what you're doing. But this allows a fairly gentle way to fabricate structures and avoid the layer by layer approaches for doing this. And so it's a really powerful technique. This is optical coherence tomography image showing you the role of a dead zone created as the object is brought up and liquid is pulled into this gap. And some people think 3D printing is an adhesion issue to a window. It's not. It's a mass transport mechanism. The oxygen creates a path for a river of resin to flow in underneath the part, and to flow in even though light's coming through here, to flow in basically an oxygen field that prevents the monomer from solidifying. And so this becomes a resin renewal approach. The polymers or the window material that we use for this is based on a fluoropolymer that we have a lot of experience with. This is among the most oxygen permeable material known. It's very chemically and photochemically stable. It's not swollen by organics, so you see some common themes coming up from our molding world. And this becomes a really great window. And what's happening from the mechanics of the 3D printing process is, if you look at the various parameters, these are the reactions that are taking place. So you have a photoinitiator dissolved in organic resin that absorbs light, generates radicals. And so when you look at the light intensity coming through the window as a function of distance up into the liquid, the light intensity is the highest right at the window exit. And then it will decrease with distance up into the liquid just due to the molar absorptivity of the resin. This light is generated in radicals, which the radical concentration will basically track with the light intensity. But when a radical forms in an organic liquid, it's got one of two fates. If there's oxygen present, it will react with oxygen far faster than it'll kick off a polymerization. That's why in free radical polymerizations, we always degas our monomers. That's getting rid of the oxygen. Here, we're taking advantage of the solubility of oxygen in these liquids and the replenishment of oxygen through the semi-permeable window. So we're creating a pathway for resin renewal at the interface, but once the oxygen concentration gets below a certain threshold, then the forward polymerization will take place, and you'll get the 3D printing of the object, and this distance here defines the thickness of the dead zone. And so that's the chemical, physical aspects that we go through in the 3D printing process. As you can imagine, it's fairly complicated. We're increasingly building a full simulation model that includes reaction kinetics, heat and mass transport, the mechanics of the part that we're generating. And I think of this as a software controlled chemical reaction to grow parts. And there's about 20 parameters or so that allow us to master this, including, as I mentioned, the dead zone thickness is a function of light intensity and oxygen flux. We control the optical density of the resin to control how far the light penetrates. And this allows us to make a variety of things. Now, to get back to the microneedle aspect, we're increasingly interested in higher and higher resolution 3D printing. And we can control the pixel size by using different digital light projection systems and control the optics so that we can make a wide range of geometries. And if you look at these geometries, you'd be hard pressed to think about how is one going to make these geometries in a fab by etching silicon if you're going to use traditional microfabrication techniques. And so I would argue we're now getting in the realm of geometries that are unfabricatable in a fab by 3D printing them directly. And what's really powerful about the quality of the 3D printing using continuous liquid interface production is the ability of making a really smooth structures. And so here's an example of a test pattern that we made where we're printing it continuously, but we divide the object into, in this case, 100 micron slices. And that was an arbitrary selection. And so it's taking this three-dimensional object, cutting it into 100 micron slices and printing it continuously. So what that means is, as a printer is printing, every image is held constant for 100 microns in Z. And once the printer head gets past 100 microns, then the next image will come on and that will stay constant for 100 microns in Z, and the image will change again. And so you get this staircasing on the surface of these structures. Well, we could divide this object 5 times more frequently and use 20 micron slices, or even going further. And so what you see is that we can basically cut out this staircasing and we can get down to an RMS roughness value of under a nanometer. So this becomes a really terrific way of making these fine features with a very smooth surface finish out of a wide range of geometries. What's also interesting, unlike traditional layer, let me back up. If you had a traditional 3D printer and you went from 100 micron slices to 1 micron slice, you would slow the printer down by a factor of 100. But we're printing these continuously and they're all printed at the same speed. We're just changing the image more frequently. And so that's the example of a continuous 3D printing process. When you go continuous and you cleave open the parts, you don't see any remnants of the layering that one has in a traditional layer by layer approach. And what happens is, this is one of the Achilles heels of 3D printing, is you have anisotropy, that the mechanical properties will change depending on the orientation of these layers relative to the part. And when you print these continuously, we get these isotropic properties, more akin to injection molding, using this continuous production of these parts. So we began using this approach to make some things that I would argue are very difficult to make in a fab. Here are some microneedle structures where we varied the needles at different diameter, or we varied the needles and had different heights. You know, one of the big challenges in microneedles is the bed of nails effect, right? When all the needles are the same size, it takes a lot of force to insert the needles. But if you can have them at all different heights, the insertion forces can be way lower overall for these kinds of patches. We can also start making things with undercuts. And so that opens up a wide range of geometries. And we can start accessing a wide range of chemistries. Here's an example where we're making cross-linked hydrogels, and we could vary the cross-link density of these polyethylene glycol diacrylate systems. We can also start making biodegradable systems using caprolactone and acrylated caprolactone systems to make systems that would be biodegradable. Or in this case, polyacrylic acid, the carbopole kind of materials, where we vary the molecular weight and we can control the dissolution kinetics. And so here's an example of some microneedles that we printed out of acrylic acid. And we're going to vary the initiator concentration and the light intensity, and we can control the dissolution kinetics. And so here we're making polyacrylic acid systems I'm showing you water rinsing over these, where we can vary the dissolution rate depending on the details of the chemistry. And so the whole idea here is that we could have a platform approach for controlling the release of cargo from microneedles by controlling the dissolution kinetics of these systems and having the ability of changing the chemistry in the z-axis allows us to make microneedles with different types of dissolution kinetics, with the goal of having an approach here where we could do a prime plus boost kinds of systems and control the release as a function of time and get into the vaccine kinetic world that, you know, Darryl Irvine is really laying a foundation for, that we're watching very carefully. So let me just show you some data now. So on the vaccine side, these are some microneedles that we're varying the surface area. And the whole goal here, this is going to be for solid microneedles, where we wanted to increase the amount of cargo per needle by increasing the surface area. And you can see we're running out of, you know, some resolution here. This is microneedles with a 20 micron pixel. You know, the commercial carbon printers are up at 75 micron pixels or greater. And we're now building printers at Stanford with smaller and smaller pixels. We think we can get down to single digit micron, under 5 micron size pixels. And we hope to be talking about that soon. But here's some work at 20 microns. We're also beginning to make hollow microneedles. And again, we're very excited about this space. You know, interstitial fluid is, you know, really an interesting place to play. You know, we have 5 times more interstitial fluid than we have blood. And we're interested in the whole lymphatic system more generally. And, but, you know, in the past, when we were doing the nanoparticle work and the microparticle work in vaccines, you know, this, in many ways, it's kind of interesting that the beautiful work from Moderna and Pfizer and other places was really a foundation that came out of the oncology world. You know, back then, a lot of us were putting the particles into an intramuscular injection, or for the mice, a foot pad injection. And depending on the labeling of the cargo and the particles, you know, we began looking very carefully at particle size and zeta potential and deformability through foot pad injections, and watching the cargo or the particle get to the draining lymph node as a function of time, and even delivering RNA replicons and other things using this kind of approach going forward. So this was a pretty classic particle vaccine approach, and a lot of people were doing a beautiful work in this area, and we were tag teaming in some of this area. But when we think about doing this with microneedles, you know, this is now really targeting the dermis in a much more precise way. And so here's some examples of microneedles that we were coating, in this case where the cargo is OVA antigen and a CpG adjuvant. And we were coating them in solutions of sugar as a dip coating and air drying. And so the whole idea is that a vitrified solid state solution of a thin film on a solid microneedle would allow us to get into shelf stable systems at room temperature. And so the idea of trying to mitigate the cold chain for these subunit vaccines was sort of the approach that we took. And then we began looking at comparing the release of these cargoes to the dermis via microneedles, and comparing it to the subcutaneous needle injection. And we could see that as we made a patch with these different cargoes on these microneedles, you know, go from 2 minutes to 2 hours to 24 hours. So we could get a large fraction of the cargo off the microneedle into the skin of these animals using IVIS imaging techniques. And so transdermal delivery by the microneedles was very efficient. We also began looking at the whole area of vaccine kinetics. And what we could see, depending on the cargo, we had different types of residence time in the dermis when delivered via the microneedles. And what we found is, for CpG, you know, we had extended concentration in the dermis as a function of time relative to a subcutaneous injection in the local site. And so, but OVA would clear a little bit more quickly than the CPG. And so it's not surprising given the different natures of these molecules. But we began then looking at and harvesting the draining lymph nodes after delivery of these vaccines. And we compared the subcutaneous injection with the microneedles. And you can just look at the overall cellularity in the draining lymph nodes, and it was far higher when we're delivering these cargo with the microneedles versus the subcutaneous injection. Shown in the black bars, you can see this increase in cellularity as a function of time. And then you can look at the details of this, and you compare to untreated versus subcutaneous. There's not much difference here, but you saw this very methodic increase in the cell type here as a function of time. And you can even see, the co-stimulatory marker CD80 ramp up with these cells when we deliver for microneedles. And so you're seeing some very strong differences between subcutaneous injection and a microneedle injection. And when you begin looking at some of the antigen-specific antibody responses, comparing the untreated animals, the blank microneedles, the subcutaneous injection, we tried intradermal as well, and we also had a control with alum, also delivered subcutaneously. The alum is a very potent, actually acts as a depot, people believe. And you can see the microneedles had a really much stronger response in subcutaneous and intradermal here. And for IgG at day 30 after the second injection, it was 50 times greater than one could get from the subcutaneous. And when you look at IgG1 versus IgG2A, you see some really interesting differences now for the mechanism of delivery. And it looks more like a more balanced Th1, Th2 response by delivering versus microneedles versus subcutaneous. And you can see this really strong difference here between the OVA system and with the alum versus the microneedle approach. And so we're very interested in this. We want to tease this out further. We also see a very strong dose sparing effect when delivering these vaccines to the dermis using microneedles. And we can also look at the T cell activation, which is all the rage right now for the coronavirus, and looking at the T cell response, we're seeing some strong differences for the microneedles for, the CD8 T cells with microneedles versus subcutaneous injection. So we're at the early stages of trying to understand this and not just doing it with these subunit vaccines, but going to some of the particulate mRNA vaccines. And so, more broadly, I would say that, what the world really needs is a platform technology that one could deliver any suite of antigens and adjuvants that are deemed appropriate or needed at the time. The potential for having cold chain independence by really having a solid state solution, the ability of having a prime plus boost in a single dose, the ability of having it be self-administrable. When you think about some of these global needs, and you think of what's the poor folks in South America and India and other places, and the ability of having self-administration is going to be important, I think, ultimately, and scalable to billions of doses. And I think microneedles could be the OS for vaccine design and delivery. It could be the operating system. And I think designing vaccines on a means of delivery is going to be a powerful approach to support these kinds of pandemics. And so we've got a great team coming together here, both at UNC and Stanford. I got some great collaborators at UNC, and Xiaomin and Jillian, former postdocs of mine who are on the faculty, research faculty at UNC, working with Mark Davis in the Human Immunology Center, Peter Kim, former president of Merck, Ron Levy, Ralph Barrick at UNC has got some of the best mouse models for the coronavirus. He was studying coronaviruses before anybody, or certainly before I heard of them. And then John Smith, who used to be the CSO of Liquidia, now he's the CSO at VLP Therapeutics, one of the world's experts in self-amplifying RNA systems. And so we're beginning to deliver some of the RNA vaccines and looking for partnerships and collaborations along with the subunit vaccines, and really looking at the comparisons by doing this local delivery and ultimately designing microneedles that are tailored with unique geometries for tailoring the vaccine kinetics that one needs for these different kinds of vectors. And I think this whole thing is scalable. What's really cool with 3D printing, I think you can make these patches for under 10 cents a pop, in a wide range of geometries, and do that out of chemistries that, it's just a sheet of plastic, sort of not to be derogatory on our own work, but these could be very sophisticated sheets of plastic with solid state microneedles that are just leaving the cargo in the dermis the way you want, and could be a very effective way, and could be pre-prepared in a pandemic world setting at a moment's notice. And it goes well beyond infectious diseases. We're looking more carefully about the interstitial fluid and lymphatic system, and really extending this to cancer vaccines and stimulating and maybe even doing CAR T therapy without removing blood and doing it in vivo directly. So anyway, let me end on just a general note. I'm a big believer in using light to fabricate complicated things. Light is an exquisite chisel. Doing things without molds and using light directly, I think, opens up lots of opportunity. And we really think it's just the beginning. And I'm a big believer in a future fabricated with light, and think there's a lot of opportunities in the space. And with that, let me thank you for paying attention and joining me here this morning. Thank you.